COVID-19 pandemic has impacted all areas of people's lives. For many, the pandemic has taken a toll on their mental health and relationships. A team of interdisciplinary researchers at Monash University have piloted Relate Me, a digital intervention using WhatsApp that promotes mental health literacy and self-coping to reduce symptoms of anxiety and depression.
We did a survey in Sekamat area, that's the rural suburban areas. We found that actually most of the people, their score of loneliness increased after the pandemic. Overall in Malaysia, we know that suicide rates go up, domestic violence go up during the first wave of pandemic.
During pandemic, we cannot reach community as usual physically, so we designed Relate Me program as a digital intervention, but taking into the consideration of the people who has a low digital literacy. We use a community health workers to run the intervention.
Community health worker will be the group leaders who recruit the people into the WhatsApp, so they know who needs help, who they can recruit. So they are the insider in the community.
Mengekalkan perhubungan sangat penting untuk kesejahteraan mental seseorang. Jadi dengan program Relate Me, kita menggalakkan peserta untuk berhubung dengan ahli keluarga, kawan-kawan dan juga masyarakat secara dalam talian sepanjang COVID.
So we call it Relate-Me, meaning that I want to be able to relate to other people. So because it's a relationship-based, so it's a group-based intervention, meaning that we put people into the group based on their age, based on their language, based on their preference.
Okey, program Relate Me ni bermakna kita macam ada satu pertalian pula. Hubungan yang baik pasal kita tak boleh keluar tetapi kita dapat contohnya kawan yang dalam WhatsApp. Yang boleh kata orang meluahkan perasaan semasa COVID lah.
At WHO, we certainly recognize the deep importance of community engagement to foster health and well-being. As we've seen across the globe during the pandemic, unfortunately, social isolation has really disrupted everybody's ability to build, maintain, and even strengthen relationships. But fortunately, we've been able to support really innovative work in communities like in Malaysia to address these very barriers. What's also very exciting about this is that the innovations from this work can be adapted to other communities, both within the Malaysian context, but also across the region to support local needs well beyond the pandemic itself.
We shift to community engagement, meaning that we go out of our therapy room, we go out of clinic and hospital to reach to people in the community, and without any fees or at the low cost of services. So that is the idea, that we want to reach out to people who suffer after pandemic and who have no access to help. They are not like well-to-do people, they can pay for service. And these are the people, they are suffering, but they don't know they are suffering mental health issues. The role of digital intervention, I think it's a future trend. Just the pandemic bring everything faster forward. In the future, it will be inevitable trend that people are seeking help through digital means.